Hi, Health Source of Mount Pleasant followers, it's Dr. Brunner, and today for Mobility Monday, I'm going to cover the upper leg, which is prescription 10. This prescription is great for helping to treat hip pain, hamstring range of motion, hip range of motion, low back pain, sciatic leg pain, and any stiffness in the upper leg, which would constitute the quad, hamstring, and the adductors. So next I'm going to do some mobility tools to help treat any of those areas. The first mob is the quad mobilization. So we're going to utilize from the top of the quad to right above the knee, and we're going to roll through there. So first we're going to pin that foam roller on the quad. We're going to go with the orientation of the fibers up and down. We find a tender or restricted spot. We're going to pause there for a second. We're going to contract the quad into the foam roller. Give it a 5-second count. Then we're going to relax and let the foam roller sink deeper into those tissues. We're also going to rotate side to side into a pressure wave, all while breathing nice and easy through it. And then lastly, we're going to then do a hamstring curl to floss that quad muscle right underneath our contact with the foam roller. We're going to do that on both sides for about 2 minutes. And we're never going to foam roll over the IT band laterally. And we can also get into the adductor muscle as well by spinning our leg out and getting up and down. And again, pressure wave side to side and contract into the tool and relax, getting deeper and deeper into that tissue. Our next mob is the hamstring ball mobilization. So you can do this one right at your desk at work. We're going to place a small red mobility ball on the high hamstring. And all we're going to do is create movement with our leg, going flexion and extension to help free up the sliding surfaces of the hamstring that get glued down while sitting for long periods of time. You keep placing that ball in different aspects of that hamstring, working your way from the proximal to distal aspect of the hamstring, and just nice and easy, controlled, about 10 reps at each spot, and just keep on moving from side to side. We can cover the whole length of that tissue on both sides for about 2 minutes each. Here at the clinic, we utilize the banded hamstring mobilization to help free up hamstring range of motion. So I'm going to demo that next. We take the red rock tape resistance band, we loop it up the high anterior capsule of the hip. We come out as if we were going to go into a sprinter stance, having both knees bent. If we can't get our hands down to the ground with keeping a nice flat back, you can use the foam roller to aid in that process. And what we're going to do with that back leg is when it's bent, now we're going to straighten it out. We're going to create a flossing movement motion, getting good mobilization on that hamstring. You should feel a pretty good burn in that back hamstring as we're flossing it back and locking that knee out and getting good shear through the hip capsule with the band. So I'm going to demo a few here. We go 10 reps on either side. Probably go 3 rounds worth all together. And this will really clear out any muscle adhesions in the hamstring. Next I'm going to demonstrate the classic hamstring stretch, but with a twist of using a contract and relax method. So we're going to take the big red mobility band, resistance band, and we're going to bring that leg up, keeping the knee locked out straight. Bring it towards you as far as you can, and then we're going to resist and push that leg away, 5-second count, and then relax. We're going to go 10 seconds to bring that leg up straight forward as far as you can, and then again contract away, 5 count, and then again flexion towards you as far as you can, and keep repeating till you can't gain any more range of motion. And we'll do the same thing on the opposite side. And that does it for Mobility Monday over Prescription 10 and the upper leg. Next week for Mobility Monday, I'll be covering Prescription 11, which will be covering the knee. I hope you have a great week, and I'll see you soon.